The STL Bucket List Show is driven by Bommarito Automotive Group. Bommarito is Missouri's #1 car dealership, and they are proud to represent the #1 podcast in St. Louis, the STL Bucket List Show. We've personally purchased several vehicles from Bommarito, including our last one, which we recently just had another baby, so we had to upgrade to an SUV with third row seating. The entire team, John, Chuck, they all treated us like family. There's really nowhere else that we would buy a car in Missouri other than Bommarito Automotive Group. Enjoy the show.
If you want to hear about St. Louis, tune into the Bucket List Show weekly. Hear what Marissa and Luke say. It drops every Wednesday. Got a dope new guest every single week. Buckle up for the ride. Who's it gonna be? Who's on the show today? They rep St. Louis. What to do in the loo on a late night, or maybe what to do on a date night. Yeah, Bucket List has you covered. They know what's going on. What's going on? They'll give you, 18 different things to do, or 19 if you need one more to choose. Yeah, this city is a place we call home. A place we call home. Yeah.
St. Louis, welcome back to another episode of the STL Bucket List Show. Our mission is to highlight the people, places, and events that make St. Louis special. And we have one of those people here that makes St. Louis special, and a special company, SSM Health. They've been partners of ours for a long time, and we've really been able to go visit some of the hospitals. We've been able to talk to some of the nurses and some of the doctors that make such a big impact in St. Louis. And we have one of those people in here today. We have Dr. Garza of SSM Health. Thank you for joining us.
Oh, absolutely. Pleasure to be here.
Yeah, I've heard a lot of stuff about you from your team, your marketing team. And I want to learn just a little bit more about, obviously, you work at SSM Health, but I want to learn more about your background. So kind of growing up, what led you to the life that you live now? And what are some of those highlights? Are you a St. Louis person? Or
Yeah.
Oh, you are?
Yeah,
Okay,
yeah,
So let's talk about that.
Yeah. I grew up in North County in Maryland Heights, around 270 in Dorset. So if you're familiar with that area, there's some apartments right off on the corner there, and then there's a church up on the hill, and I live right behind the church there. So grew up there, me and my 4 brothers.
Nice.
So, the typical question that everybody asks, where did you go to high school? So I went to St. Thomas Aquinas High School in Florissant, which is no longer with us, downsizing of the Catholic education system, things like that.
Mm-hmm.
Grew up in St. Louis. My mom's from Southern Illinois, my dad's from Texas. But me and my brothers all grew up here.
Yeah, that's awesome. And I know you have a military background. So did you go straight into the military after high school, or did?
No. So I sort of had a circuitous route throughout my life, and it's been a little bit unconventional, I would say. So I after high school, I moved to Kansas City and went to college at UMKC. And then after attending college there, so I was pre-med biology, decided I didn't want to go to medical school right away. And so I went to paramedic school. And so I worked as a paramedic in Kansas City for a couple of years before going to medical school in Columbia, so University of Missouri, Columbia. Came back to Kansas City and did my training in emergency medicine, and got my master's in public health at St. Louis University, and then joined the military while I was a resident. So I was a second-year resident in emergency medicine when I joined the U.S. Army Reserves.
Yeah. Wow, that's awesome.
Yeah.
So as a leader, in a leadership role, you obviously have been through some big things. I know one of the big things, was the pandemic response. Walk us through what that was like for you. And what kind of the privilege, but also the pressure that was of you in that role, because you had to make pretty big decisions at that time.
Sure. Yeah. So, I wouldn't say that we made decisions. I think we tried to give good advice and information to the public, as well as to, government officials and healthcare systems and things like that. I think that's one of the misnomers that people have about the Pandemic Task Force is, we couldn't make decisions on our own.
Of course.
We of course advised people on what we thought were the best decisions. And so just taking a step back from there, when COVID first started rolling out, so it just, again, a little bit about my history. So during the Obama administration, I was the Assistant Secretary for Health Affairs and the Chief Medical Officer at the Department of Homeland Security. And so a big part of our mission was dealing with pandemics, bioterrorism, nuclear terrorism, you name it. And so this was something that was, it was something that was known to me. And so used to do pandemic preparedness for the federal government while I was in that office. And we always thought that the next pandemic was going to come out of the Far East. We thought it was most likely going to be H5N1, which is highly pathogenic avian influenza. And so after I left the federal government, I stayed involved in emergency management, emergency preparedness, and emerging infectious diseases was always something that I kept my eye on. And so when COVID first started breaking out, even before it was called COVID, it was something that caught my eye about, hey, this could be the one. And as it kept rolling on and on and on, and you saw it exploding across China and then across the Middle East and then into Europe, it became clear that this was going to be the one. Mm-hmm. So in anticipation of that, I was chief medical officer at SSM at the time. And so I spoke with our infection preventionist and various other people, and we set up our emergency management structure. I always tell people we started out in a small room with 4 people, eventually became a bigger room with like 10, 15 people, and eventually we took over the whole first floor of our headquarters and had stopped essentially all other operations to set up our own command center. And from there, it then morphed into BJC, Mercy. Other people were doing the same things, and much to the credit of our healthcare leadership, came together to discuss these issues and said, "Hey, we need to form this task force." I had the unfortunate, I guess, occurrence of being involved in large scale operations and emergency management and those sorts of things. So they asked if I would serve as the incident commander, and of course I said I would, and we sort of took off from there. It was challenging at times. Well, most of the time it was challenging because you were dealing a lot with the unknown. I mean, nobody had heard of this was a new coronavirus. Nobody had seen it, heard it, knew how to treat it. We didn't know where this was going to go, how many people were going to get sick, how many people were going to die. Mm-hmm. And so planning in uncertainty is extremely challenging. And you have to be able to be comfortable in uncertainty in order to sort of remain clear and level-headed when you're going into these issues. So
First Community Credit Union is the official banking partner of STL Bucket List. They've been serving St. Louis families for 90 plus years with 40 plus local branches and over 400,000 members. From personal credit loans to mortgages to kids and teen accounts, they also have a partnership with the STL Blues. You see Louis here if you're watching on YouTube. We're proud to use First Community. I use it for my own family and my own business. We're excited for them to be the official banking partner of STL Bucket List.
That was a long-winded answer for you.
No, that was
I apologize.
Great. No, I loved learning about that. So obviously, nothing really prepares you for that type of situation, but all the stuff that you did leading up to that from working, with the federal government and all these different things of crisis management, they're like, hey, this is you. And then you had to then step in and, be that leader, but also, you were speaking on the things you were speaking. And these were things that the uncertainty that you mentioned is like, and this was probably March of 2020 is when all this started. It started pretty quickly.
Right
at that time. So then you probably had other projects you were working on. And then it was like, hey, all hands on deck task force. And over at the headquarters in Crew Corps, you guys all took over that task force.
Yeah. Right. Yeah. For SSM, that's where we took over. It was over in Creef Corps. Yeah. Right. And, I remember those early days where we just said like, we need to stop doing everything else. This is the crisis. We need to be focused on this. And it didn't take a lot of, explaining or cajoling or anything. I think people by then saw that this was going to be a crisis.
Yeah. No, that's interesting. So there was something that you said really powerful before that I noted here, and it says no one wants to be an ER, but something got them there. What do you mean? What does that mean to you, and what do you mean by that?
Yeah, so I'll trace that back to in the beginning part of my career after I was a paramedic and did my residency in emergency medicine. So I'd practiced academic emergency medicine for a little bit over a dozen years, And what that is you're teaching the next generation of emergency medicine physicians, so teaching medical students and residents. And so back in the day, so I'm old enough to know that we used to practice medicine before an electronic health record. And we had a whiteboard. Essentially, it's a big whiteboard where we put patients' names, what was wrong with them, what labs they needed, things like that. And every shift change, you would run through the board and explain, hey, this is what's going on with this patient, this is what they need, so on and so forth. And so what I used to do with the residents is I would say, now tell me which one of these problems is not a public health issue. And invariably, it was nearly all of them that were public health issues. And so if you think about the patient that's in diabetic ketoacidosis, they're not there because they want to be in diabetic ketoacidosis. They're there because they couldn't afford their insulin. The person that's the gunshot victim doesn't want to be shot. They're there because there's an intense amount of urban violence going on. The patient that comes in that's homeless and psychotic, they're not there because they want to be homeless and psychotic. It's because they couldn't get access to behavioral health therapies or, couldn't get on the right medications, maybe couldn't stay on their medication. So each of those different clinical scenarios, but they all show up in the emergency department. So each of those different clinical scenarios, yes, in their own individual right, they're clinical issues, but the larger context is something happened where they ended up in that bed in front of us. And it was something that was outside of the healthcare system. It wasn't, that we didn't properly diagnose somebody or get them the right prescription or things like that. There were other things at play that brought them to the emergency department.
Yeah, there was other factors. And that was another thing I wanted to touch on is like, how does someone's zip code end up being more important than genetic code when it comes to health? Because I know that local relevance has a lot of big factors into that too as well.
Yeah, absolutely. So if you look at demographics from the different areas where people live, and it's a little bit of a misnomer to say your zip code determines your health status, because the zip code is really just a surrogate marker for things like poverty or for built environment or all of these other things that contribute to health. If you look broadly at it, though, and some of the statistics are very shocking, there's an 18-year difference between 8 miles between two different zip codes within the St. Louis community. So if you look at, North City, life expectancy there is probably mid-60s. If you drive down the road 8 miles into a place like Clayton, the life expectancy is up into the 80s. And so so what's the difference between those two regions is a lot of poverty in North City and not so much in Clayton. Now, that contributes to a lot of things. So, lack of housing, lack of transportation, lack of access to healthcare, lack of education, all of those different things, which really are the true drivers of what builds health in the community.
And a lot of that is, health starts way before someone gets sick. And I know we talk about that too of,
Absolutely.
the housing, the food access, safety, education, transportation, stuff that some of us take for granted. But yeah, I think that the work that you're doing and the impact you're making, what does it mean to be able to do that in St. Louis? Because obviously you're a St. Louis guy, and being able to make an impact in your own community, I think is pretty special because you kind of traveled to other places and you found your way right back here in St. Louis. So.
Yeah. No, it's very rewarding. I certainly, and I tell people this all the time, I have the best job in healthcare. I really think that because, you're able to work on some of the larger issues that really drive health within the community.
Yeah.
All of those different things that I did throughout my career, whether it was in the military or in medicine or things like that, have all, I think, led me to this job that I have today. Now, the other part of it is that it can be incredibly frustrating as well, because these are large issues that you alone are not going to be able to solve. So in some ways, you sort of miss that very individual mission of being an emergency physician where it's, hey, here's the patient, treat the patient, they either get admitted or discharged, and you move on. But these issues that we're tackling in community health have been developed over generations, and it's not going to be hey, if we can just do this one thing or start this one program or invest in this one issue,
Mm-hmm.
that it's all going to go away. These are deeply persistent issues. But on the other hand, that's also why we're here,
Yeah.
is to work on these issues to make the community more healthy.
For over 150 years, SSM Health has been providing hope, healing, and opportunities to the St. Louis community. With over 40,000 employees across 4 states, they're not only delivering exceptional care, they're one of the region's largest employers, shaping the future of healthcare. We're proud to present SSM Health as the official healthcare partner of the STL Bucket List Show. If you've dreamed of a career where you're truly making a difference every day, SSM Health can help you take that to the next step. Learn more at their website in the link in the show notes. Yeah, no, and I think that, being able to make that impact at SSM Health. So how does all of this that you do translate into care at SSM, leading to action when you guys lay out these plans and asking patients questions from everything that you guys do from the top that leads all the way down to that initial experience that they have at one of your hospitals?
Yeah. So our strategy within SSM for community health is sort of 3-layered as I describe it. So that top layer is really working on those big social sort of issues at the community level. And we do that through a couple of different ways. So one is impact purchasing and impact hiring. So we want to make sure that we're using our dollars wisely to support the communities where we are. So now certain things you can't do that for. So, you can't have an electronic health record that isn't large enough to serve your community, but we can make sure that we're supporting our communities where we can with the dollars that we spend. So whether that is with purchasing services, making sure that, we're opening up in employment to everybody to improve the communities. Those are big things. And then the other things that we do is we invest in the communities as well with some of our investment dollars.
Mm-hmm.
So things like a depository agreement at the St. Louis Credit Union to make sure that credit is available for people that typically are unbanked or don't have access to credit, because that prevents people from, using predatory lending or getting into deep debt. And it provides them resources so that they can continue to improve their economic outlook. So that's sort of the top layer. That middle layer, which is more specific to SSM, is when patients come to our facilities, we recognize that they're more than just that clinical picture sitting in front of us. They're more than just that person with diabetes or congestive heart failure. They have things going on in their lives that, again, brought them to the emergency department. And so we ask them what those issues are. We have a standardized set of questions that we ask them about social determinants of health, whether it's housing, whether it's food, whether it's transportation, all of those different things. And it's to try and understand what are some of the challenges that they're facing outside of this clinical issue that we can help them with. Anybody that answers yes to those questions, yes, I'm having a challenge, we then find resources for. So we match them up with our social workers, our case managers, other people. We develop relationships out in the community so that we can deliver resources to people that have these challenges. And one of the most significant ones is our efforts around food insecurity. And we run what's called a breadbasket program in each of our hospitals, where if a patient comes in and says, yes, I'm having trouble meeting, my nutritional requirements, they don't have enough food in their home, then we can give them food to go home with for 2 days for them and their family. But even beyond that, we set them up with the St. Louis Area Food Bank so that they can get on the path to food security. So that's really the important thing. And then that last piece really is the things that are within the 4 walls of SSM, and that's health equity for clinical outcomes. So we know patients from different demographics will have poorer outcomes, and we want to make sure that we're doing everything within our power and the clinical care that we deliver to make sure that we're treating everybody equitably, that we're driving outcomes that improve the lives from the care that we deliver. And so that's at the very sort of base level of what we do. We provide healthcare.
Yeah.
And we want to make sure that we're delivering the best healthcare for everybody.
So you mentioned your partnership with the STL Area Food Bank. Would you say that food insecurities in some of these food deserts are a big leading impact to some of these social impact issues that you guys are seeing?
Yeah. So if you look at all of the issues that sort of span the metropolitan area, that does bubble up as one of the most significant issues. So every 3 years, SSM, as well as our other healthcare partners, have to do what's called a community health needs assessment as part of the Affordable Care Act. So every 3 years, in order to maintain our IRS not-for-profit designation, we survey the community and we talk to people and we talk to groups and we say, hey, what are the most pressing issues that are going on in the community right now? And food insecurity is one of the top three that people tell us, yeah, this is a significant challenge for us in our neighborhoods. A couple of the other ones are things that you would suspect. So across the board, so not just here in St. Louis, but also in some of our other markets in Wisconsin and Oklahoma and Southern Illinois, behavioral health, mental health, substance use disorder, far and away are some of the biggest issues.
Hmm.
Which is another reason why we devote a lot of our resources to addressing behavioral health, both here in St. Louis and Oklahoma and elsewhere, whether it's through our behavioral health urgent cares or long-acting clinics, things like that. But some of the other ones are things like violent crime, particularly in the urban core. And so we take that information, we share it with our groups, but we also try and devise implementation plans or improvement plans on what can we do as a healthcare system to try and improve on these issues. And so that's why you see all this programming around food insecurity with the food bank, with the bread basket, with all of these other initiatives, behavioral health, huge investment in behavioral health.
And all that ties back to these community needs assessments that you guys
Yeah.
do. So walk us kind of through what that looks like. I mean, that obviously you guys just wrapped up one. That's a big project. You know, it's
Right.
not just asking a few questions. There's a
Yeah.
lot of deep research that goes into that.
Yeah, it's like a year-long project.
Yeah.
And if you think about it, we do it every 3 years. Now, I mean, not much changes in 3 years, so we kind of know where we're starting out at. But
Yeah.
it's things like you want to ask the communities, what do you think is going on? Why do you think we're having a challenge with health in the community?
Mhm.
We do that through surveys and through focus groups and things like that. We also ask our partners, especially our partners that are in the community benefit organizations, the different people that provide social services. What do you think is going on? And we ask our own workforce, what do you think is going on? And then we do a deep dive into the data too. So whether it's CDC data or economic data or any amount of data, and we try and pull that all together and say, okay, what do we think are the most pressing issues in the community? What are the things that we should be thinking about or working on? We develop this report and then we develop our plan on how we're going to address these. We collect information as the years go on, like this is what we've been doing, this is where we think we're seeing an impact. And then that rolls into the next 3-year cycle.
Mhm.
The other important partner, and sorry, I forgot to mention this, is our public health partners. So the city, the counties, all of those different organizations participate in this as well. Now, oddly, they're on a 5-year cycle, so they're a little bit off kilter with us,
Mhm.
but we all participate together.
Yeah.
The big thing is we as healthcare systems, we all do this together. So SSM isn't rolling out a plan and then BJC and then Mercy and then so on and so forth. So we all look at the same data. We all participate in the same surveys.
Mhm.
So it's a
Use each
very
other's
collective.
resources to help.
It's a very collective effort. But we recognize that people in the communities, regardless of what healthcare system they go to, they still have to face the same challenges. And so it just makes sense for all of us to come together and do it.
No, that's inspiring. So we talk about these factors that impact health, but what are these formally called in healthcare? You know?
Yeah, so they're formally called the social determinants of health. And again, I'll parse that word there, to determinants, because it doesn't really determine that you're going to be somebody with a poor health outcomes, but they certainly make it a lot harder to be healthy.
Yeah.
And so those are typical things that we've already talked about, whether that's housing, transportation, education, jobs, money, all of those different things contribute much more to the health of the individual, to the tune of 80 to 90%. Healthcare, I mean, we're really good at taking care of people.
Yeah.
You come to our doors, we're going to take care of you.
Yeah.
But what we can't do is build housing. What we can't do is promote economic expansion. We do within the healthcare sector,
Right.
but this is something that's bigger than healthcare. Keeping people healthy
Yeah.
is really it depends on the community. It depends on
Mm-hmm.
our metropolitan area. Everybody has to be engaged in this if we really want people to thrive,
Mm-hmm.
to be able to live their best life.
Looking for something light, crisp, and absolutely refreshing? Zwickle Light by Urban Chestnut is the official light beer of the STL Bucket List Show. It's less than 100 calories, and it's the perfect drink for summer. Enjoy a beer at the beer garden, in the Grove, or chilling at home in the backyard with your friends and family. This episode is sponsored by Upshot Coffee, 3 St. Louis area locations in Cottleville, Break Shop in St. Charles, and their new Hi-Fi location in Clayton. I personally use Upshot Coffee every day at my espresso machine at home, and I try to visit one of the shops at least once a week. They source the beans responsibly from local farms all across the world, and they take care of their staff and they take care of the community. Let's get back to the show. And then that kind of leads to my next question is the importance of the public and also our healthcare professionals of being educated about these things. And that kind of leads with, you can do as much as you can within those 4 walls and obviously bigger than that, but it's like, how do we expand in the importance of, not only just the public, but also the healthcare professionals and how do they stay educated on these things?
Yeah, it's really important that we as healthcare professionals stay engaged in this. And I'll tie it to a couple of things. So when I was in medical school, and I think most people that are in the healthcare professions, whether it's medical school or nursing school or any of the allied therapies, things like that, rarely get any education or any knowledge about social determinants. It's certainly become much more prevalent here lately, but I know when I went to medical school, we didn't speak about economics. No,
Yeah.
it was pathology, it was physiology, it's microbiology, and all of the clinical training. But I think since that time, we've all come to recognize that these other issues have dramatic impact. So one of the things that we're doing is making sure that we are educating our workforce on this is why these things are important. This is why people show up in the emergency department. This is why we have these disease patterns within our patient population.
Mm-hmm.
And that's important that people understand the why. And I also think it helps them then understand the bigger issues that are contributing to disease. But I also feel like it gives them a little bit more purpose for what they're doing. When they can send patients home with food, understanding that they don't have food at their home, I think it helps drive the mission.
Yeah.
And it makes people feel good about what they're doing. And healthcare, as you know, is it's labor intensive, it's hard work, it's busy work. And sometimes it can get frustrating when you see people coming with these same diseases and these same issues. And I think this kind of brings a little bit more life to the care that we deliver.
And when you mention like people coming into the ER over and over and over again, but they're not, but they're not necessarily sick in the way that you might think that they keep coming back, and like what else could be going on behind the scenes and all the stuff that kind of goes into that. So,
right, no, exactly. So we've dealt with patients like this all the time in the emergency department that keep returning. It's typically that they have chronic conditions, or mostly they have social issues that are going unaddressed. And that becomes really difficult in the emergency department. But if you can invest a little bit to help people with those social issues, you do see dramatic declines in them returning to the emergency department. So they're using that for to meet their immediate needs, and frankly, they have nowhere else to go.
Yeah. No, that's that you see it and you hear about it. And so I kind of want to wrap up with a couple things about St. Louis. So, this is kind of a hard question, but it invites like a nice answer as far as what would a healthier St. Louis really look like if we took all of these ideas completely serious. And I know you guys are taking them, but as far as like if we made a decision that like kind of like what you had a task force is like, this is another one of those things where we need a task force with these issues. So what would that look like?
Yeah, it's a good question. I don't know if there's a simple answer other than I think we need to promote awareness that these are the issues that are driving sometimes holding us back as a
Mhm.
community.
Yeah.
If we can do economic development, education, jobs, all of those different things. You hear that phrase, a rising tide raises all boats, and this is the same thing. If we can invest in people, invest in education, it's going to pay dividends way down the road. People are going to, have better jobs. They're going to become more economically viable. They're going to be able to own their homes. They're going to be able to have that transportation. But it all starts with investing in people and in communities. So
Mhm.
whether that's in the private sector or whether it's in the public sector, those are the things that we have to keep in the forefront. And I also think it's also awareness. Sometimes we get a little fragmented, and it's not just here in St. Louis, but how we have all of our little cities and things like that in the county. But you tend to stay cloistered amongst your own group. But having that awareness that you know what happens to the overall community is better for everyone. It can't just be focusing on my single community. It really has to be the greater community
Mhm.
that's going to make this region thrive.
Of course.
And so if we can all invest in that,
Mhm.
I think we'd see some tremendous results.
The STL Bucket List Show is proudly sponsored by Suede Dispensary. With 11 Missouri area locations, Suede does so much for the St. Louis community. We've been working with this team for a couple years back since medical was here, and we're excited to support their new product launches, events, and community initiatives. We couldn't be happier to work with this premier cannabis brand, and we're excited for them to sponsor the show. Enjoy the rest of the podcast. I agree with you. It's something that we try to talk about a lot, and everybody, because it's easy to just see what's going on. But now with the power of social media, you can really see, obviously we had that traumatic tornado that just affected North City
Absolutely.
and other communities.
Right.
And those people are still going to be dealing with that, although the news has stopped about it. There's, still, people that need help and, in other communities that had the same tornado hit, they're already cleaned
Yeah.
up and different things like that. So,
Yeah.
obviously, I think the power of social media and the internet is that we can get access to this information a little bit easier, but then also it's easy to just, be in your own bubble, and
It is.
worry about your own family. But so I wanna wrap up by talking about St. Louis. So St. Louis guy, from the Maryland Heights area. What are some of your STL bucket list spots? So when you think of I can make it really easy for you. So let's say you're celebrating something, maybe an anniversary, maybe like a career accomplishment. What type of place are you going to? Is there a place in mind that sticks out to you as that spot?
Yeah. I don't know as much about, we always love going down to the hill,
Yeah.
right? Like
Yeah.
to get really great Italian food.
Of course.
I will tell you like some of my most memorable things that I did as a kid here.
Yeah.
And that was going to Creve Coeur Park.
Yes.
Yeah, that was right down the street
Such a good spot.
from our house. And,
Mhm.
that was back when we used to, soup up cars and stuff like that. And so you'd go and cruise the park. And so that was always like a favorite,
Yeah.
thing to do while we were growing up here. Since I got 3 boys, and so they're very sports minded. So we always love participating in sports, but also going to, Cardinals games and Blues games, and
Mhm.
haven't been to a soccer game yet. So,
Yeah.
but looking forward to that. And then one thing that's a little bit different than that is we enjoy going to the symphony.
Yeah.
We have an awesome symphony here,
Mhm.
and I think it flies under the radar a little bit nationally,
Mhm.
but always love going to the symphony.
Yeah, St. Louis is such an arts town. People think of it as a sports town, and it is, but more people travel to St. Louis for the arts. So you think of the Muni, the Fox, you think of the Symphony, and obviously they're going through one of the most beautiful rehab buildings.
Right.
If you've seen the plans for that, it's going to be unbelievable.
It's gonna look amazing.
And that's right down the street from your guys' SLU location. So, just being able to have the Grand Center Arts District and like how many free things to do. And I have two little kids, and the amount of stuff we do in St. Louis that actually, you think when you have children, you're like, okay, I'm going to spend so much more money and all these things. But like the amount of stuff we have in St. Louis to waste a whole day in Forest Park and not spend any money is really, really special.
The zoo is phenomenal.
Yeah.
We're so blessed to have such an amazing zoo here, and it's free.
Yeah.
Well, it's not free. We pay tax for it, but
Yeah.
but and that's virtually unheard of.
And all the local, like my little kids, like all the local libraries, like all the free story times we get to do, and just all these amazing things to really be able to raise a family in St. Louis. And that always ties back into jobs and the amount of jobs that SSM Health offers to people in St. Louis, not just jobs, but careers. And I've talked to a ton of the people that work for you guys and really get to see the impact. And I think it's really cool and inspiring what you get to do, and hope you continue to make an impact in St. Louis. But just to wrap up, I mean, give us some thoughts on maybe how people can learn more about this information, or maybe how they can follow along on. A lot of our listeners are following on social media or different things like that, and how they can stay up to date with what you guys are doing.
Yeah, I would say paying attention to the SSM social feeds. I post regularly on LinkedIn and not so much on Facebook, but more on LinkedIn. But SSM has channels on Instagram, LinkedIn, Facebook, various other platforms that I think people could follow along on. And there's other organizations as well that participate in a lot of work that we do. And so I mentioned a few. But that's also a good way to stay connected.
No, that's great. Well, I appreciate you for coming on. Thank you for your time. And if you guys want to learn any more about this, we'll drop some information in the show notes, and we'll see you guys next week.
Hey, St. Louis, Brent Labowitz law firm, personal injury law firm here in St. Louis. Excited to be part of the STL Bucket List and sponsor them for their podcast. Just want to go ahead and say, if you ever need a personal injury lawyer here in town in St. Louis, give us a call, look us up. You get involved in an accident of any type at all, give us a call, free case evaluation. We'll try to walk you through the process.
Today, they rep St. Louis. What to do in the loo on a late night, or maybe what to do on a date night. Yeah, Bucket List has you covered. They know what's going on. What's going on, they'll give you, 18 different things to do, or 19 if you need one more to choose. Yeah, this city is a place we call home. A place we call home, yeah.